Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, Iain Rankin, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Marla. Good afternoon, and welcome to Phase 4. As we enter this next phase, I'm very happy to report that there are no new cases reported today. I want to thank all Nova Scotians for their sacrifices in following the public health protocols. This has been a long haul, but you continue to do your part and protect one another. We are not clear of COVID, but we are containing the virus when it makes its way into a community. When we've had spikes, our public health teams have been agile and able to move in with testing and making sure individuals are vaccinated. Our plan at the border is working, and I want to thank people coming into our province for filling out the safe check-in forms as you come in and respecting the rules here. In fact, 37,345 forms have been filled out just since June 30th. Our vaccine program is also working. We've reached the milestone of 75% uptake for first dose, which allows us to get safely into the start of Phase 4 as that minimum threshold we wanted to see. So thank you for that. And we're not done yet. We need to get the percentage up for second doses. We're at 45% of those of Nova Scotians, but we need to get higher. And the only way that number moves up is if people who are eligible book their second shot and get to their appointment. In this phase of our recovery, we're more open and have fewer restrictions. You've earned the right to larger gatherings, later hours, and a lot more activity. But this doesn't mean that we're out of the woods yet. We still have to be mindful and cautious. We can enjoy this phase of newfound freedoms. However, until we get our vaccination coverage up and our second doses up, we can't let our guard down to get ready for the next phase. So thank you, and over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And today is our 150th COVID briefing. And what a year and a half it has been for all Nova Scotians. So I'm pleased that we are reporting 0 cases today as we enter Phase 4 of our reopening plan. Phase 4 means most businesses are open at 100% of distance capacity, that there are larger gathering limits and less restrictive masking requirements. And on masking, as a reminder, children 12 and under no longer need to wear masks indoors in childcare centres, day camps, or overnight camps. And also, all Nova Scotians no longer need to wear masks outdoors in public places like playgrounds, parks, and markets. However, indoor masking in public places is still required. Until 75% of our population has 2 doses of vaccine, we will not be able to move beyond Phase 4. We need to make sure we have the strongest possible layer of protection that 2 doses of vaccine can provide from COVID-19 and its variants. Late yesterday, we received results from the National Microbiology Lab identifying 36 cases of the Alpha variant and 20 more cases of the Delta variant. We are still matching these results with individual case data, so I don't have any more detail at this time, but I can say this: the Delta variant is in our province and has been in our province, and we know that 2 doses of vaccine are needed for good protection against this variant strain. Our vaccination target for Phase 4 was 75% of all Nova Scotians with a first dose, and we've met that, but it is a minimum target. We can and we need to, and I believe we can go further. And today we're at 75% who have either come, we're at 75% who either have or are booked to get their first dose, and people are still coming out for that first shot. Just yesterday, we delivered 1,200 first doses of vaccine. And we have 45% of all Nova Scotians who have now had 2 doses. So if you're eligible but haven't yet rescheduled your appointment to get your second dose sooner, please do that. 2 doses means you're fully protected against the Delta variant. And for most of us, this does mean mixing Pfizer and Moderna vaccines. They are the same type of vaccine, and mixing them is completely safe. The mixing of vaccines is not a new concept. Public health has been interchanging types of vaccines such as MMR and hepatitis B for years. And this week, comments by a World Health Organization scientist during a media briefing were taken out of context and have created confusion around the mixing and matching of COVID vaccines. Media reports suggest that Dr. Swaminathan said that the World Health Organization does not recommend mixing and matching of vaccines. However, if you listen to the full interview, it reveals that she was actually answering a question about booster doses and people seeking a third or even fourth vaccine dose. She cautioned that people shouldn't decide this on their own without evidence, but need to rely on advice from national or local public health expert bodies. She was not talking about Canada and many other countries' approach to mixing and matching first and second doses of Moderna and Pfizer. In Canada, we follow the advice of independent experts on the National Advisory Committee on Immunization. They have reviewed the existing evidence on all COVID-19 vaccines and have made a recommendation on mixing based on that information. And their recommendation is that it is perfectly safe and effective to do that, and people shouldn't worry about what type of mRNA vaccine they get, but get the very first opportunity they can get to get their second dose. And they would not make this recommendation unless it was not safe, and I have full trust in their recommendation. So please do not wait to get your second dose. The risk of COVID-19, and particularly the Delta variant, is very real, and being fully vaccinated is our best defense. If you've got your first dose 28 or more days ago, book your second dose or go to a walk-in clinic as soon as you can. And I've been asked many times when we will get back to normal. And while I do not believe that we'll ever return to our pre-COVID normal, I do think that there will be a new normal that will see us living more freely and openly with COVID-19. Eventually, we will approach COVID much like influenza and other respiratory viruses. The lessons that the world has learned from COVID will forever change, however, the way we manage and respond to all of these respiratory viruses. This new normal is within our reach. The next phase of our reopening will likely mean few or no restrictions and no mandatory personal public health measures. But there may be certain settings or situations where some precautions are required, at least in the short term. So my public health team and we're working on this now with other government departments, and we're considering all the elements of our pandemic response to determine what transitioning to living with COVID-19 looks like for things like testing and contact tracing. We'll have more to say in the next few weeks to come as we get closer to achieving our 2-dose 75% minimum target. Until then, follow the restrictions and public health measures required for Phase 4. Wear your masks in indoor public places, keep your distance where required, keep your close social contacts small in number, stay home if you're unwell, get tested if you have symptoms, and please get your vaccine.
Thank you. We'll now take one question and one follow-up from media in the amount of time that we have. We're going to begin in the room with Taryn Grant, CBC. Go ahead, Taryn.
Dr. Strang, I think I understood what you said about needing some more details about the variant cases that were identified today. But so far, do you know whether the Delta variant was driving the third wave of COVID in Nova Scotia? And as you learn more about those cases, what else are you hoping to learn about the role that variants have played so far?
The driver of the third wave was the Alpha variant, and that was across the country. The Delta variant has come in the latter stages of the third wave. The real concern is the Delta variant has the potential, if you don't get high coverage with 2 doses of vaccine, the risk of the Delta variant is creating a fourth wave. So what we're doing right now, we just got the information yesterday, so we're matching individual lab results with the epidemiology around each of the cases and putting together a picture. I'm not surprised by this, fully expected to see it. It doesn't change what we do moving forward in responding to any new cases. Just like when we knew it was the Alpha variant, it didn't change fundamentally what we did. It explained why the dynamics and why we're seeing such a rapid spread of cases. What it does, it is actually for Nova Scotians, it helps us understand, hopefully, and confirm that we have the Delta virus, there's the potential for that Delta variant. It's been detected recently here in Nova Scotia. And so the best thing we can do, the best defense against that, I keep sounding like a broken record, but it is highest possible two-dose coverage. That is our best line of defense, and especially identifying the Delta variant now confirms that that is something we need to pay very close attention to.
Do you have a follow-up?
Yeah, so given that we're seeing fourth waves of COVID occur in other parts of the globe, and as you said, Delta variants are driving those, I wonder if you could tell us a little bit about how your office is preparing for the possibility of a fourth wave here, and how restrictions might look similar or different to previous waves if we should encounter a fourth wave in Nova Scotia.
So first and foremost, where we're seeing, and I've said this before at recent briefings, where we're seeing resurgence of COVID in parts of the U.S. Just saw this morning in Australia that Sydney's gone for another 2 weeks of lockdown. It's the Delta variant in combination with under-immunized populations. The defense against the Delta variant and what we need to do to minimize the chance of a fourth wave is that high two-dose coverage. However, if we did somehow get a resurgence, we would use the tools you use against the Delta variant are exactly the tools we've used previously. Restrictions, mandatory public health measures, contact tracing, enhancing testing. Our strong desire and everything we're building, why we're focusing on vaccine, is to never have to use those again. Everybody I talk to is all in agreement. We need to do everything we can to avoid a fourth wave. And that's why, again, I'll say it one more time. The way we do that is everybody who can get 2 doses of vaccine.
Next, we'll go to Paul Bacon with All Nova Scotia. Go ahead, Paul.
Strang, earlier this year, during Newfoundland's provincial election, there was a spike in COVID cases. They had to take measures, including eventually cancelling in-person voting. If a similar spike in cases happened during an election here, what advice would you offer, or what steps might you take?
Well, I mean, it's a hypothetical. If there was something, I'd have conversations with senior officials in government, and we'd engage elected officials and develop an appropriate plan.
So there is a strategy, there are contingencies?
We haven't developed detailed plans, but we would respond as necessary. If that's I would say it's a remote possibility, but we don't even have an election called yet. But it's something we have we're well aware of that and how we would need to respond if necessary.
Next, we'll go to Tim Busquet with the Halifax Examiner. Go ahead, Tim.
Hi, thank you. Dr. Strang, I don't want to make too big of a deal out of it, but we're not at 75%. We're at 74.1%. And you made the qualifier that either people have had a dose or have booked a dose. By my math, that's well into next week, probably Thursday or Friday. But we've pulled the trigger on the 75% threshold for phase 4. Is that a fudge or an aspirational target, or?
As I said on Monday, there's 8,000 Canadian Armed Forces who live and work in Nova Scotia. For privacy and data sharing reasons, we can't incorporate their individual level data so it appears in the Nova Scotia data. And that's at least 1%, but we absolutely know that there are another roughly 1% of Nova Scotians who have had 2 doses of vaccine. We just can't, because of the reasons we can't incorporate them. So we are we are very comfortable and confident we are at that 75% target when you incorporate those armed forces members. They just can't, for all the technical reasons around privacy, data sharing, they can't appear in our data, and so you don't see them on our dashboard, but we are at 75%.
Go ahead with your follow-up.
You've been very clear that it's safe to mix the mRNA vaccines and that's the best defense against the Delta. I'm wondering, though, those of us who received a first dose of AstraZeneca and have gotten a second dose of the mRNA, is that an appropriate defense against the Delta?
Absolutely. I think, and actually the recommendation is that it's a preferred approach. If your first dose, as we've got more evidence and information, if your first dose was AstraZeneca, the recommendation was preferentially to get your second dose with either of the mRNA vaccines.
We'll now move to the phone lines. We'll begin with Natasha Pace with CTV. Go ahead, Natasha.
Thank you. Dr. Strang, we learned this week that 2 people have died and a third person is sick after spending time at an apartment at Alderney Manor. My understanding is that there is testing going on at this particular apartment building for the Legionnaire bacteria. In light of this, has the health department issued any kind of restrictions regarding the water in that building?
That has been followed up by NSH Public Health with one of the regional medical officers of health. My office doesn't get involved in those individual case investigations, and they are working with the housing authority like they've done previously to take appropriate testing and other steps. We don't know what the cause of these deaths or what's going on in this building, and my understanding is appropriate testing is taking place to get a better understanding of what's going on. But that is at the local level with NSH Public Health.
Do you have a follow-up, Natasha?
Are you worried, Dr. Strang, about the health of any other residents in that particular building, or do you know if anyone else has become sick?
So I would ask that though your question is best deferred to NSH. As I said, that's like every day. There's follow-up on various notifiable disease conditions by local public health. I don't have details on those.
Next, we'll move to Alicia Drost with Global. Go ahead, Alicia.
Thank you. Dr. Strang, this stage brings new freedoms for residents of long-term care homes, but we are hearing that not all of these facilities are necessarily on board with lifting restrictions. I'm just wondering if you can elaborate maybe on why that is, or do homes actually have to lift restrictions when the province does, or are the eased restrictions just sort of guidelines?
So we give guidance documents to long-term care homes, licensed long-term care facilities. The government has a contractual arrangement with them. Ultimately, they are independent operators, and so if they're not following the guidance, I would say that they have to then provide a rationale to the families as to why they're not following the public health guidance that is developed for all of the long-term care sector.
Alicia, do you have a follow-up question?
I do. Just in terms of uptake for the second dose, are we seeing any increase over the last couple of days, or does it still look like there is hesitancy with people maybe waiting for Pfizer? And if so, is anything going to be done to encourage people to book that first available second dose appointment?
So we're starting to see the needle shift a little bit about more people being willing to just take the first appointment. We are expecting much more Pfizer to come starting next week, so that'll help things out as well. I've been delivering the message for the last couple of weeks at this briefing. We're using social media, other communication tools to make sure all Nova Scotians are aware of the importance and the rationale of that it's perfectly safe for them to move up as long as they have a 28 days, then to move up and get their second dose of vaccine as quickly as possible.
We'll go next to Nusheen Ziafati with the Chronicle Herald. Go ahead, Nusheen.
Thank you. We've heard that Seneca College in Ontario will require its staff and students to be fully vaccinated before they return to in-person activities this fall. Are you recommending that post-secondary schools here follow suit?
No, we're not, as public health, and we're not recommending mandatory vaccination policies for any organization or business. In fact, we say that if that's ultimately their decision to make. But anytime the issue comes up in any conversations I have, I identify there's substantive human rights and legal and ethical and equity issues that need to be explored carefully before you mandate or create policies based on denying access to people who aren't fully vaccinated.
Nusheen, do you have a follow-up question?
No, thank you.
Okay, we'll move next to Michael Tutton with the Canadian Press. Go ahead, Michael.
Good afternoon, Dr. Strang. What is the current daily rate of second doses?
I don't have or maybe I do. Let me see if I have the vaccine numbers. It depends on actually how much vaccine we have available about our supply. So let me see if I can give you an answer. If we so our planned for the next week coming up is for this week it's ranged between roughly 10,000 doses to over 30,000 doses. All that depends on our supply of vaccine and the delivery. So it changes every day, but our objective all along has always been to match vaccine supply with appointments, and we have capacity to deliver every dose of vaccine we get in a very timely manner.
Michael, do you have a follow-up question?
And do you have a best case scenario then, maybe a worst case, for the phase 5 that so many are looking forward to in terms of how many days or weeks from now we could be looking at?
So given what we expect to get vaccine supply in the coming weeks and anticipating that the appointments for all that vaccine would be filled, we're still on target that we certainly could reach phase 5 by end of August, end of summer. If things change, it may be slower, but if we get even better uptake from Nova Scotians, we have more. We may be able to go sooner than that. So that is the challenge for Nova Scotians. If you love phase 4 and you want to go to phase 5, well, then we need everybody to get who can to get their second dose of vaccine as quickly as possible. That's the challenge for all of us, and then we can do more. We can be even further remove restrictions, remove mandated public health measures. I think that's everybody's objective, but it depends on our vaccine uptake.
We'll go next to Kiera Moreland with Radio Canada. Go ahead, Kiera.
Hi there. I'm not sure who this question would be for, but I'm just wondering, multiple provinces and countries have started speaking about possible vaccine passport, either saying they would implement them or not. I'm curious to know if this is something we could see in Nova Scotia.
Well, right now we're looking at what the federal government does, first of all, for international travelers, which would mitigate much of the risk, given that all provinces are seeing relatively good uptake of their vaccine, first and second dose, and so we're watching what the federal government does. And I know a number of provinces have come out with an official position. We're still watching what's happening, and interprovincial travel right now is really monitored very closely at our border, and we'll continue to do that through phase 4.
Kiera, do you have a follow-up question?
Yes, I'm wondering, some people have been saying coming back to Canada because their kids are under the vaccination age, they can't get in. Is that something that would apply for Canadians coming here, or have we heard of that happening to people coming to Nova Scotia?
So that's at the federal level, and I know the federal government is looking at right now that if children under 12 cannot be immunized, they have to undergo a 14-day quarantine. I know the federal government is looking at that, but that is at a federal level, international arrivals. Nova Scotia, we've said for domestic people coming from outside Atlantic, other parts of Canada, outside Atlantic Canada, our position is a little bit different. We've said that children, even anybody under 18, traveling with their parents, if they follow the quarantine requirements of the least vaccinated parent. And so kids under 12 traveling with vaccinated parents, into Nova Scotia from other parts of Canada, would not have to quarantine.
And finally, we'll go to Victoria Walton with The Coast. Go ahead, Victoria.
Hi, thank you. Dr. Strang, talking about coming up to phase 5 and loosening restrictions, will there be any more restrictions lifted, kind of like a mini phase, a smaller individual restrictions lifted, do you think, before we get to the full, no restrictions at all?
So we're looking at that. Are there some pieces, such as very large gatherings of people, how we bring, events where there's thousands of people, how we do that? Maybe there might be a couple of increments in there. We don't go from phase 4 to 100% capacity at very large venues, potentially. So we're actively looking at that. Most of the other measures, restrictions, really relate to when we would lift the indoor masking and remove the requirement for physical distancing, because virtually everything else is open at 100%. So that's the thinking, but we still have some work to do and some final decisions to be made for the details of phase 5. But essentially, it would be lifting most, if not all, of the restrictions and moving what I call the personal public health measures, masking, distancing, etc., from a mandatory piece to we'll take a more of a health promotion approach to those and encouraging people to do them at certain times of the year or in certain settings.
Victoria, do you have a follow-up question?
I do, thanks. And Dr. Strang, I'm wondering, phase 4 restrictions open up dance floors, but they also say social distancing is required between different groups. So with the pent-up demand for people to get out again, and the easing of boundaries and intermingling that often comes from alcohol consumption at bars and clubs, how do you suggest Nova Scotians, maintain social distance and follow rules when they're out this summer and kind of a fun thing to end on. Do you have any suggestions for COVID-friendly dance moves?
So I don't have any suggestions for COVID-friendly dance moves. I'll leave that to people's individual creativity. My kids would kill me if I tried to even go there. I think we're still in COVID. We're not out of the pandemic. So even though we're opening things up, yes, nightclubs, et cetera, are open. We really ask Nova Scotians to be aware of the requirements so they can get together. They'll be indoors, groups of up to 25 that can, not require distancing. They're indoors, so they have to have masks unless they're actively eating or drinking, and they can dance together in a group of up to 25. Licensed establishments are going to be watching and trying to enforce those, but at the end of the day, we need individuals to follow those rules. We've opened things up a lot. Stay within the rules, though. This is how we manage this additional level of risk now we've taken in phase 5 as we continue to build the vaccine-based defense wall that we need.
And those are all the questions we have for today. Go ahead, Premier.
Thank you. This is a good time in Nova Scotia. Families and friends are reuniting, and we are welcoming visitors to our province, and our businesses are coming back. We have a lot to be thankful for in this, our 150th briefing. To Dr. Strang and his tireless work and for his steady hand in helping us guide us through each wave of this pandemic and each phase of our recovery. To his team and all of our healthcare providers, a huge thank you for helping to keep us safe. I also want to mention the successful conclusion of a healthcare agreement with our healthcare workers. It's a fair deal for workers and for taxpayers that respects the work that they have done for all of us over the last year. And to all Nova Scotians, thank you. We would not be entering phase 4 without your continued commitment to following public health protocols. Your respect for the rules has helped position our province, but we still have some work to do. Our best defense against COVID is certainly the vaccine. We can't just rely on one dose, though. We need everyone who is eligible to get that second dose. If you think you only need the one shot because others have 2, that's not accurate and it will not protect you. This is so important and we are so close. We can't let up now. We have the vaccine, we have the openings, we just need you to book that appointment. So get out and get your second shot. Please don't wait, do it now. It's not for yourself, it's not just for yourself, it's for your entire community. Thank you.